The Balance Center has been active since 2007. We put it together because there became an obvious need for the management of patients with balance problems. For patients who have neurologic conditions such as diabetic neuropathy, where their feet are numb and the nerve function is impaired by the diabetes, or may have a neurologic disease such as multiple sclerosis, myasthenia gravis, ALS, so-called Lou Gehrig's disease, or has had a stroke or a concussion, which has caused some impairment of the patient's balance function. All of these are clinical conditions that we can provide help for. Kelly Marchetti, who is our lead therapist, has additional certification and training in the treatment of balance disorders, and our other therapists are brought into the team to expand their skills and provide also the same level of care.
So as we go into the balance machine, we always put a safety harness on, and that's more so just to make sure that whoever is being tested is comfortable with the fact that they are not going to get to hold on to anything.
What we do at the Balance Center is focus on initially an assessment to help us understand what components of the balance system are impaired, and then based on that finding, come up with a treatment plan.
Our balance is comprised of 3 different systems: our vision or our eyes, our inner ear, and the information from our feet and our joints, otherwise called our somatosensory system.
As the system, the equipment, moves the patient's platform on which they are standing, and we measure what is called the amount of sway. So it's a non-invasive technique that gives us an ability to assess the patient's ability to maintain their balance.
So one of the things we do for our training once we've completed the balance testing is to put you in a mock grocery store aisle. So I'm going to increase the challenge of this activity by asking Richard to identify items off the shelves as they go by, and he still has to sway around those boxes. And this just got more difficult visually because there's more things now to look at. Right? I'm going to add some difficulty again. And this is the nice thing about this equipment, is we can continue to change the difficulty based on how the person is progressing.
And this is what we do at the Balance Center. If you have questions or concerns for yourself or family members, please don't hesitate to get in touch with us. It's best if you have a referral to our center from your primary physician, but you certainly can contact us for the initial appointment that we can help coordinate through your physician. Thank you.